For appointment *03081388988. Fasting during pregnancy is a topic that has been discussed by many healthcare professionals and religious scholars for decades. Fasting is defined as abstaining from food and drink for a certain period of time, and it has significant importance in Islam. However, when it comes to pregnant women, fasting may have potential risks and adverse effects on both the mother and the developing fetus. In this article, we will explore the importance of fasting in Islam, relaxation guidelines for pregnant women who wish to fast, and the impact of fasting during the first, second, and third trimesters of pregnancy. Islam and fasting. Fasting is one of the 5 pillars of Islam and is observed by Muslims around the world. During the month of Ramadan, Muslims abstain from food, drink, and other physical needs from dawn until sunset. The main purpose of fasting in Islam is to develop self-control, discipline, and empathy towards those who are less fortunate. It is also considered an act of worship and a way to purify the soul. Relaxation guidelines for pregnant women. Pregnant women who wish to fast during Ramadan must first consult with their healthcare provider to assess their overall health and determine if fasting is safe for them and their developing fetus. The decision to fast should be made in consultation with the woman's doctor, as the safety of fasting depends on various factors such as the woman's health status, the stage of her pregnancy, and her ability to cope with the physical demands of fasting. If a pregnant woman decides to fast during Ramadan, she should take certain precautions to ensure her safety and the safety of her developing fetus. These precautions include consuming a well-balanced diet during the non-fasting hours to provide adequate nutrients to the developing fetus. Staying hydrated during the non-fasting hours by drinking plenty of water and other fluids. Resting as much as possible during the day and avoiding strenuous activities. Breaking the fast immediately if she experiences any signs of dehydration, fatigue, or dizziness. Impact of fasting during pregnancy. The impact of fasting during pregnancy depends on the stage of pregnancy. In general, fasting during pregnancy can lead to dehydration, low blood sugar levels, and other complications that can be harmful to both the mother and the developing fetus. First trimester. During the first trimester of pregnancy, fasting can lead to an increased risk of miscarriage, preterm labor, and low birth weight. This is because the developing fetus is highly dependent on nutrients from the mother, and fasting can limit the amount of nutrients available to the fetus. Second trimester. During the second trimester of pregnancy, fasting is generally considered safe for women who have a healthy pregnancy and are not experiencing any complications. However, women who have a history of gestational diabetes, preeclampsia, or other pregnancy-related complications should avoid fasting during this period. Third trimester. During the third trimester of pregnancy, fasting can lead to low blood sugar levels, dehydration, and preterm labor. It is generally not recommended for pregnant women to fast during this period, especially if they have a high-risk pregnancy or have experienced complications during their pregnancy. In conclusion, fasting during pregnancy is a topic that requires careful consideration and consultation with a healthcare provider. Pregnant women who wish to fast during Ramadan should take precautions to ensure their safety and the safety of their developing fetus. It is important to note that the decision to fast during pregnancy is a personal one, and women should not feel pressured to fast if it is not safe for them or their developing fetus.